Today we're gonna adjust her. It's my daughter. And so, if you couldn't tell. And so, go face down, girl. So can you put your head here? And go right down. So she hit her head yesterday, and this is the first time that I'm actually checking her. And so what I want to do a good job of is to make sure that her neck is moving. With pediatrics, most of the technique is going to be tonal. So it's fingertip pressure. With kids, you can really feel where inflammation is or a lack of motion is. If they don't like it, they definitely will let you know. And so a lot of times we'll see their hands kind of reach for our hands, or they will just move around a lot and just try to get away from the pressure. Good. So even when we check here, she has a lot of inflammation on the left side, so my thumb side. So we're gonna spend about 10 seconds here. And all I'm gonna do is, I'm taking my thumb that's on her neck and we're just gonna push in and out. 1-2 visits into a lot of pediatric adjusting, the kids are really, really comfortable with what we can do. Most of the times they just jump up right on the table and we rock and roll. Good. Face me this way, Ember. Can you turn on your side? See, we've been doing this for a long time, haven't we? Have we been doing this for a long time? So Ember's been getting adjusted since she was born. And on this, we're just gonna give a little push. Good. And then we're gonna have her go on her back. Kids fall, so that's one of the big things too with kids. Adjustments don't have to necessarily be after like a trauma or a fall, but we know it's gonna happen. But some of the things that people come in with their kids is maybe inability to latch, so the kid's not latching to the mom. Maybe some colic, so the baby's fussy, not sleeping. And then also things like the baby's just really gassy in the sense of after every feed, which goes into more of a colic approach. Sleeping is a big one as well. So if the baby's not sleeping because of maybe discomfort levels, would be a good reason to get a kid checked. So now what we're gonna do is we're just gonna put a little bit of motion into the cervical. Good job. You can see that she doesn't mind that. Good. And then we're gonna check the other side of her hip. So on this one, most kids are gonna stay here and then we just manually will move them. Supporting them is always gonna be a big thing. They're mostly cartilage and so they're very flexible. And so just like an adult almost, we just wanna make sure we support them and then get the segments moving that we need to. For her, she's been walking for a long time, but through the transition of like going from crawling to walking, that's a good time to get kids checked. Most parents are really aware of if the kid is walking maybe with a little bit of gait dysfunction. And so we always want to make sure that we clear the hips out. That's a big time to get them checked. Does that feel good? Does that feel good? He's so serious. Good, come sit up. Go sit up. Good, turn this way. You're all set. All done.